I'm Dr. Robin Steely, and this is Oral Fitness for Life. If I could show you a way that you could have no bleeding in your mouth and no decay ever again, would we have something to talk about? To many people, a claim like that is almost too good to be true. There are two reasons that people lose their teeth: bad bacteria and bad bites. For many years, dentistry has spent countless hours learning to be tooth mechanics. We've gotten really good at repairing and restoring the ravages of dental disease. We have lots of modern techniques to manage disease. However, is this really what we desire for our lives? Do we want to continue to just put the fires out, or do we want to prevent the fires from starting in the first place? Bad bacteria in the mouth are responsible for the oral infections in over 75% of adults and kids. These infections can affect your entire health and wellness. When these bacteria are out of balance, there's disease. These bacteria set up communities in our mouths called biofilm. It is a thin, sticky substance that coats our tongues, teeth, and tissues. While there are over 800 different types of bacteria in the mouth, there are 8 to 11 of them that are considered high risk for overall health and wellness. These pathogens are aggressive and are causative and linked to major illnesses. As infants, many of these bugs are transmitted to us by our parents. How quickly they grow depends on our genetic makeup, our immune systems, and our nutrition. As we mature, so do our bugs. The area of tissue in our mouths is about the size of the palm of my hand. Wherever there is bleeding, even the slightest amount in our mouths, it is an open wound. If we had a cut on our hand that continued to bleed constantly, wouldn't we want to do something about that? Considering this fact, normal gum tissue should not bleed. If it does, these high-risk bacteria can get into the bloodstream, travel the entire length of your body in 60 seconds or less, and begin to infect these other organs and our overall health. The bacteria attack the cell linings of the arteries and begin the dirty work of causing that lining to relax and open up. When they become lodged in the walls of these inflamed arteries, our bodies send an army of infection-fighting cells to attack the bad guys. With proper nutrition, exercise, and the appropriate treatment protocols, the bad guys can be completely eliminated. However, if they are not, the linings of the arteries will continue to be inflamed until they rupture and a clot is formed. In inflamed arteries, clots are easily dislodged, where they can cause an event leading to a significant disability and even death. Using microbiological testing, with a simple swish and swab test of your saliva, we can know specifically what the bad bugs are and custom tailor any treatment to extinguishing the fire. Dr. Michael Roizen of the Cleveland Clinic Wellness Institute says, "I believe that dentists should be on the front lines fighting the health crisis that is destroying our nation. The paradigm for dental disease has changed. We have become the gatekeepers combating systemic disease. We no longer just clean teeth. Instead, we spend time coaching you to simply and effectively eradicate the bad bacteria. When you can clearly see how healthy you want to become, we can design a master plan that will eliminate gum disease and eliminate decay." I'm Dr. Robin Steely, and I want you to have oral fitness for life.